So I'm going to talk about religion, spirituality in coping with stress, illness, change, loss. And then I'll talk about the research on religion, spirituality, and mental health, and then address some of the clinical applications. So here we go. And then we'll have time for questions. And I hope there's lots of questions. So religion is a coping behavior. Many Americans and Canadians, including young adults, turn to religion, spirituality for comfort during highly stressful situations. It seems that during these highly stressful situations is when religion really becomes most important. Research shows that the people from the military to hospitalized patients to just people out in the community really become more religious when they go through traumatic or difficult life experiences. This is especially applicable to experiences that involve uncertainty, fear, a loss of control. A lot of these feelings are among all of us because of the COVID-19 pandemic now. There is so much uncertainty, so much fear, so much sense of, we're just not in control of this, that it's affecting the mental health of different populations. It certainly affected the mental health of people here in the US. And consequently, there was a recent study showing that searches for prayer on Google searches for prayer are at unprecedented levels. In other words, there has never been as many searches looking for the term prayer in the history of Google until today. So today, it's the highest, indicating that stress is high and religious coping is also high. Okay, so the question is, does it help? Does it really make a difference in terms of a person's mental health? And this is particularly important for counselors and psychologists and psychiatrists to know about this. So let's look at this connection between religion, spirituality, and mental health. Now, a lot of this research can be found, a lot of the earlier research can be found in the first two editions of the Handbook of Religion and Health. And I recently updated some of this research in a 2008 publication titled Religion and Mental Health, Research and Clinical Applications, published by Academic Press. So if you want to have some of the more recent research, you can go to that particular source. But what's coming out in probably the spring is the third edition of the Handbook of Religion and Health, and it has virtually all of the research looking at mental health, social health, behavioral health, and physical health. So that book is about 1,900 pages, nearly 600,000 words, and it reviews the research and the clinical applications in a very comprehensive manner. Now, there are also some articles that are currently out there that I've included in this slide in the British Journal of Psychiatry Advances. So there's one that looks at the latest research and one that looks at the clinical applications. Okay, so any sense of approximately how many quantitative studies published in academic journals have examined the relationship between religion, spirituality, and health? Take a moment just to think about that. Would you choose less than 50, 50 to 99, 100 to 499, 500 to 1,000, or more than 1,000? Now, these are published academic papers in peer-reviewed journals, and the time is prior to the year 2021. What would you guess? you don't have to answer that. But if you selected 5, more than 1,000, you would be correct. In fact, it's probably now more than 4,000. So there is an enormous literature base now on these connections between religion, spirituality, and both mental health, physical health, social health, behavioral health, now in the published literature. And I'm going to review some of those studies in mental health. So the next question is, what percentage of those studies report a positive relationship between religious, spiritual involvement, mental, social, behavioral, and physical health? Because you know that behavioral, social, and physical health also influence mental health. So all combined, what percent would you guess? So the question is 1, 2, 3, 4, or 5. So the answer is, sorry about that. The answer is 4. So it's somewhere between 51 and 75% of the published peer-reviewed literature, a significant correlation between religious or spiritual involvement and better health. And these are all quantitative studies that I'm referring to. This is based on a systematic review. So let's begin with depression. Depression is one of the most likely conditions that you're likely to see as you are treating patients. It's one of the most common emotional disorders in the world, and it's the most disabling disorder of all conditions, including physical conditions, really second only to heart disease. So depression is a difficult mental that is associated with great pain and suffering, and it disables people in dramatic ways, in ways that they can't work, they can't relate to other people socially. Literally, they have so much pain that many of these individuals want to die, and do actually end up killing themselves. So based on our systematic review conducted prior to 2011, which is in the first and second editions of the Handbook of Religion and Health, of the 444 quantitative studies, 61% found that those who were more religious were less depressed. They recovered more quickly from depression if they did get depressed, and individuals with depression responded significantly to religious interventions. So that's 272 of the 444 studies. And if you looked at the more high quality studies, the percentage actually increased to 67%. These are the larger studies, the better studies, that controlled for various predictors, longitudinal studies. The better study, 67%, found lower depression among the more religiously involved. Now, 6% of the studies actually found more depression among the religiously involved people, but those tended to be cross-sectional studies. And there are clearly 10 times more studies finding benefits of religion and spirituality compared to those finding worse outcomes here. Now, this is a study published in JAMA Psychiatry. JAMA Psychiatry used to be the Archives of General Psychiatry, which is considered the best biological psychiatry journal in the world. It's the most rigorous. It has the highest impact factor among biological psychiatry journals. And this was done by a group at Columbia University in New York City. What they did was, this is a psychiatry group that has been studying the effects of depression on the brain for decades. And what they found is that individuals at high risk for a major depression, because their parents had a major depression, or they were genetically at risk because of the family history of depression, they noticed that those individuals at high risk had multiple areas of their cerebral cortex that were actually thinner, significantly thinner across all aspects of their cerebral cortex. So what they did was in a following study is they looked at the brain structures of individuals at high risk for depression who indicated that religion or spirituality was either very important in their lives or was only somewhat important or was not important. And so here are the findings from that study. So you can see here all of the red areas of the brain of the cerebral cortex that have reduced cortical thickness. These are actually the brains of individuals for whom religion or spirituality was not very important. Okay, so this slide is of the brain structure of individuals whose religion or spirituality was not very important. If you look over here, these are the brains of individuals for whom religion was very important. You can see a lot less red in these brains, when you compare them. Really, all aspects of the cerebral cortex seem to be in better shape among those for whom religion is very important. So what this study suggests is that religious involvement, it doesn't show that because it's not a prospective study. The design doesn't prove that religion made a difference in these brains, but it is certainly consistent with that finding that religious involvement may in fact have actually help to either expand these areas of reduced cortical thickness or help to protect the brain from developing the reduced cortical thickness to begin with. So further studies need to show that this is really a causal effect. Now this is a study, it's interesting studies by the Harvard School of Public Health looking at the risk of developing depression over a 3 to 6 year period in a sample of nearly 10,000 young people. So these are individuals, average age of 23 at baseline, and they followed them for 3 to 6 years. What is remarkable about this study is that these are investigators from the Harvard School of Public Health, and they immaculately controlled for over 24 other predictors of depression. They even adjusted their p-values for multiple comparisons, since this study looked at many different mental and physical health outcomes. So that was corrected for by the Bone-Ferroni correction, which is actually a conservative correction of the p-value. Despite that, what these investigators found was a greater than 30% reduction in the likelihood of developing a depressive disorder among those young people who attended religious services at least once a week. The risk ratio here is 0.69 with a confidence interval that is less than 1 and statistically significant, even after all of these controls and all of the p-value corrections. What about suicide? Suicide, in the U.S. Is now, at an unprecedented level. It's going higher and higher. Some of it's due to the COVID-19. Some of it just has to do with everybody's upset over everything, basically. And this is a big issue. But among studies conducted prior to 2011, when the second edition of the handbook was published, the systematic review showed that of 141 studies, 106 found that those who were more religious had more negative attitudes towards suicide, less often, and completed suicide less frequently. Since then, there have been a couple of studies, one an 18-year prospective study of over 20,000 persons age 18 or older in the US. This is actually a very, very famous study. It's the NHANES 3 study. This study has been tracking cardiovascular disease and emotional health problems, for almost 2 decades. And it involves a random sample of the US population. They also looked at the incidence of suicide. So after controlling for gender, age, size of household, previous suicide attempts, and marijuana use, they found an 84%, actually a 94% reduction in the risk of completing suicide among those who attended services 2 times per month or more. So that's a 94% reduction in completed suicide among those attending services 2 times per month or more. More recently, a study again published in JAMA Psychiatry. This other study was published in the British Journal of Psychiatry, but this study is in JAMA Psychiatry. This is the Biological Psychiatry Journal. They're again looking at the suicide incidence rate per 100,000. What they found in this study of nearly 90,000 women prospectively followed for 14 years, what they found was that the suicide rate after controlling, again, this is the Harvard School of Public Health doing this study, controlling for every possible predictor of suicide, over 2 dozen predictors, and then controlling the p-values, what they found was a 7 times greater likelihood of completing suicide among individuals who never attended religious services compared to those who attended services at least once a week. So this is pretty powerful evidence by a major research group published in the top psychiatry journal that religious involvement in a religious community really seems to make a difference. Now, this is another study out of the Harvard School of Public Health. This is actually looking at diseases of death from diseases of despair among nurses in the US. So this is a 16-year prospective study of 66,000 women that examines deaths of despair. In other words, deaths that are due to drugs, alcohol use, or suicide. Again, controlling for more than 25 demographic, psychological, social, and physical health correlates, showing a nearly 70% reduction, nearly a 70% reduction in the likelihood of actually dying from a death of despair among those attending religious services once a week or more compared to those who never attend services. In addition, this study showed a P for trend. A P for trend means that basically a dose effect response. In other words, the more the attendance, the greater the effect on reducing the likelihood of deaths of despair. And what this indicates is it provides evidence towards, again, a causal effect of religious attendance on deaths of despair in terms of protection. Now, this looks at the same outcome, but among US professionals. These are dentists, pharmacists, optometrists, osteopaths, podiatrists, veterinarians. This is a sample of 43,000 men, and these men have been followed for 26 years. So among those men attending religious services at least once a week, there's a nearly 50% reduction in the hazard ratio for dying from a death of despair in age-adjusted models. Again, showing a P for trend, as the previous study showed. What about alcohol use, abuse, and dependence? Again, our systematic review of studies conducted prior to 2010 found that 86% of studies, most of those studies being done in young adults, found that those who are more religious or spiritually involved actually actually have lower alcohol use, abuse, and dependence. And this is statistically significantly lower alcohol use, abuse, and dependence. And all of these are quantitative studies published in peer-reviewed studies, in peer-reviewed journals. Now, in fact, of the best designed studies, 9 out of 10 reported this finding. Now, since 2010, there have been a whole lot of studies looking at religious involvement and alcohol use, and virtually, again, 90% of these studies find that religious people just don't use alcohol as much. This particular study was a national sample of 20,000 U.S. adolescents that were cross-sectionally assessed over 8 years, showing that young people who are part of a religious group, who would be considered to be high in terms of their religiosity, just don't start drinking alcohol as early in life as those who are low in religiosity. Those lower in religiosity end up starting to drink at a younger age, compared to those with high religiosity. And what that ends up resulting in is higher rates of alcohol use later in their teenage years, as well as in adulthood, and greater rates of alcohol abuse as well, often affecting these young people's ability to complete their education. Now, this is a study of US veterans comparing individuals with high and low religiosity based on religious attendance, private prayer, and reading religious scriptures, and level of intrinsic religiosity, the extent to which the person's life revolved around their religious faith. And you can see here some of the outcomes. In terms of lifetime PTSD, there's a greater than 50% reduction in the odds ratio of having that. In terms of lifetime major depressive disorder, there is a 50% reduction in the odds of that happening among those with high versus low religiosity. In terms of lifetime alcohol use disorder, there's a 1/3 reduction in likelihood of having that in terms of lifetime rate. Now, in terms of current PTSD, there's a 70% reduction. And in terms of current alcohol use disorder, there's a greater than 70% reduction when you compare high versus low religiosity. And this was published in the Journal of Affective Disorders in 2017. What about illicit drug use? Kind of really the same relationship. Religious involvement is related to less drug use, abuse, and dependence, 84% of studies, even a little higher in the best design studies. And if you look at randomized controlled trials or experimental studies, you find that virtually all of them find that a religious or spiritual intervention reduce illicit drug use and abuse. Here's a study of about 3,000 drug abusers, and then they're looking at them after 12 months of follow-up, showing that, again, those attending religious services are more likely to be in a drug abuse remission state compared to those who never attend or who attend less than once a month. Now, this is a model that helps to explain how religious involvement affects a person's mental and social health. And I'll probably end on this, but I'll show you some further resources too that you can, if you want more information about this, you can go to these other resources. But let me explain how religious involvement, attendance at services, prayer, scripture study, volunteering for religious reasons, religious education, religious devotion, and religious coping. How does it influence mental and mental health? Well, first of all, there are both direct effects shown by this arrow, direct effects, and indirect effects. Oops, sorry about that. Indirect effects through all of these different mediators. Okay, so religious involvement actually begins to affect a person's health before they're born. In fact, it affects it before they've even been conceived, even before they've been conceived, because of the religious behavior of their parents or their parents-to-be. There is research showing that the behavior of the father and the mother prior to conception will influence the genetic vulnerability to changes in the brain once the child is conceived in the womb. Then once the child begins to grow in the womb, in other words, their brain begins to grow, which is very rapid towards the latter part of pregnancy and then continues, for after birth, that brain development is influenced by several factors. One has to do with the use of drugs and alcohol, and one of the other ones has to do with the stress level that the mother is under, which may be affected by the young mother being separated, or maybe under a lot of stress because they have to work and they've got several kids at home, and now they've got this child, they're pregnant with a child. All of those stressful hormones are influencing brain development in the womb. And then, if mothers are less likely to use drugs and alcohol and have lower depression and less stress because of their religious faith, that's going to affect that child's brain development. There's no question about that. Also, when the child is born, the religiousness of the parents also seems to influence the degree to which the child is nurtured in terms of, and that's going to not only affect their genetics based on epigenetic phenomena and risk for later stress-related disorders, but it's going to influence their sense of basic trust, which is so crucial for later mental health as well as physical health. So religious families, whether they're Christian, Muslim, Jewish, there seems to be a greater value of children. There's more value placed on having children. That's one of the reasons why in Islam, Islam is expected in the year 2100, in the next turn of the next century, to actually be larger than the Christian population in the world, simply because of the birth rate and because Muslims value children. That's also true for Christians and for other faith traditions. And then as the child gets into teenage years, being raised in a religious home, there is more monitoring. In other words, religious parents are more likely to check up on and monitor their teenagers. Consequently, those teenagers can't get away with stuff. And also, teenagers who are raised in a religious family don't use drugs as much, as alcohol as much, don't end up dropping out of school as much, don't end up getting pregnant as much, don't get involved in delinquent activities. So consequently, those children are going to get a better education. They're going to have better afford health insurance and all of that because of the religious faith of the family that they grew up in. Then as these children become, these teenagers become young adults, then there's the issue of the stability of their marriage, of their relationships, and their mental health as well. And then they grow older, they get into old age, and then there's real problems that develop. Then you get sick, you get disabled, you can't do what you used to be able to do, you lose your loved ones. Really, later life that's the Super Bowl of life in terms of stress, in terms of change, in terms of loss. And that's when religion really makes a difference. Okay, so that's basically it. I'm not only is religion related to better mental health, it's related to more physical activity in a positive way, less extramarital sex, and safer sexual practices in 86% of studies. Now, the only problem with religion is that religious people tend to weigh more. They tend to be, eating seems to be the only thing that's not prohibited in many religious faith traditions. So they end up having more weight. But in terms of cigarette smoking, 90% of studies show less cigarette smoking. I'm not even going to go through these. There's physical health. They have better immune function in the majority of studies, better endocrine functions. We did one of the first, they have lower inflammatory markers. They have better cardiovascular functions. Here's an early study of ours. Here's a more recent study looking at self-reported hypertension, 12-year prospective study, Harvard School of Public Health, showing a close to 10% reduction in self-reported hypertension, lower cerebrovascular disease mortality. It just goes on and on. Lower rates of coronary heart disease, better survival after open heart surgery, lower cancer diagnoses among young people. This is the 3 to 6 year study of close to 10,000 young adults, average age 23. There's a 2/3 reduction in the development of cancer, the risk of cancer. Again, the Harvard School of Public Health, International Journal of Epidemiology. All-cause mortality, 68% of studies show that religious people just live longer. Not only are they happier, less depressed, and have fewer physical illness, but they live longer as well. Anyway, so it just goes on and on and on, the research. And consequently, if you look at all of the research on religion and health, many more studies show that religious people are just healthier, mentally, physically, behaviorally, and so on. Here's our model that explains these effects. This is actually a monotheistic model from Western traditions. So in summary, religious involvement, particularly faith community involvement, is related to better mental health, better behavioral health, and improves over time among those who are more religiously involved. It's also related to better physical health. What I didn't show you were studies showing, better physical functioning and lower cognitive decline in later life. But that's true as well. So in any case, here are some further resources in terms of application to clinical practice. Here's a book that has specific chapters for different healthcare professionals, including counselors, psychiatrists, nurses, physicians, that reviews this. This is 2013, but it shows the clinical applications, mainly the clinical applications taking a spiritual history. You got to take a spiritual history on all your patients to find out whether or not they're religious or spiritual, and address their mental health problems in light of those religious or spiritual beliefs or lack of beliefs. We have a research workshop. I know it'd be great to have some of you in Canada come to our workshop. It's next year. It's on site. We've got great researchers from Duke, Yale, Emory that teach this. Send me an email there if you're interested. Here is a book that describes research in this area. It's actually a summary of our 5-day research that we've been doing, for about 20 years. And here's our website. Lots of important material here. And I'm going to stop right now. Let's have some questions.